I wanted to first ask the panelists, especially Ans and Alexa, who you've both attended the past meetings for this conference. Can you tell us a little bit about your past experiences and your perspective on the future agenda setting at the upcoming COP meeting, where climate and health will be a major theme of discussion amongst policymakers?
COP is definitely a place for kind of the center of world leaders to come and talk about health and agriculture and all the different kinds of topics that you could think about. But it's also a place for the public to kind of have their own voice. There are separate sections that people can attend. And so in light of the current climate issues that we see, we really expect for health to be kind of the centerpiece of this COP, which is unusual compared to the last COP. So the last COP was centered around finance. Moving on from that, issues of finance in terms of health crises is really important to pay attention to now too. Specifically to my research as an agroecologist, I'm really interested in seeing exactly how we're going to feed ourselves within the next 50 years, but I'm happy to be going to Dubai and kind of exploring exactly what aspects of health will be discussed.
When it comes to international climate negotiations, it's just remarkable to me just how oblivious the US population is about these conversations, and that includes academics. And the challenge there really is that what the United States does basically sets the tone for the rest of the world, right? So which is all to say, it's an invitation for all of us to think about carefully what is our role in setting that agenda, right? Asking our congressional as well as our other elected officials in the executive branch to negotiate on our behalf, to negotiate on behalf of climate justice, right? As opposed to what our government has always historically done, which is negotiate on behalf of the industry.
I want to shift now a little bit into another really important domain of scholarship and academia, which is this space of educating the next generation of scholars that are interested in climate change, justice, and health. So can you reflect on some examples of innovative climate change and health content in your courses, and what kind of impact you've seen in your students, and what they've sort of taken away from it?
One other piece that is increasingly obvious to me are around these questions of mental health. We oftentimes pathologize what I think is a pretty normal and reasonable response, which is that our society, our climate is in crisis. And so some people label people being concerned about that as climate anxious or climate anxiety. It makes a challenge as a faculty member because, for example, when I taught a course, there's one module on climate change and mental health, and the students asked if I could pull it up in the syllabus, do it earlier, because they were all feeling impacted. I then had to pivot and say, okay, how do we think about hope in this context? How do we think about reimagining futures and working together? How do we think about finding happiness in a collective and shared vision for the future? And so those are some of the things that I'm thinking about and working through as an educator in this space.
I think we probably have time for, one more question or a few. So piggybacking off that, what is something that gives you guys hope right now? I think some of you maybe touched on that, but this topic can be very heavy. Obviously, we talked about anxiety and mental health. We talked about, the concerns that feel largely outside of our own control. So what is giving you guys some hope right now?
Yeah, I think it's important to historicize our existence and remember that, at this point in time, it may seem all is lost. So even someone like me who is just hypercritical of structures and systems, end of the day, I'm an obnoxiously optimistic person, right? So, and I always give this example to people that if you were to go back just a few decades, none of us were a possibility in a space like this in academia. And that's what you have to remember, right? So at that point in time, if you proposed that people with these intersectional identity who are sitting here right now were an absolute impossibility. And for people back at that point in time, that was a totally, absolutely normal thing, right? So like, they could have never imagined that this is a possibility, right?